Hi, my name is Zoe Griese, and I'm currently a third-year nursing student at UOIT in Oshawa. I will be completing my fourth year of the Bachelor of Science of Nursing program starting in September 2014 with a hope for graduating in April 2015. I'm currently doing this video to just introduce myself a little bit and tell you guys a little bit about myself, as I am extremely interested in applying and hopefully getting my fourth year consolidation at the Sick Kids Hospital. As a student, it's very important for me to try and get involved as much as I can, try and learn about these facilities that I tend to apply to. Sick Kids has been a very, very, very interesting spot for me, as I'm extremely interested with pediatrics and the oncology side of nursing. As a student nurse, I take into account the vision of the Sick Kids Hospital, which is healthier children in a better world. I also take into account your mission statement. As it is, as innovators in child health, we lead and partner to improve the health of children provincially, nationally, and internationally through the integration of care, research, and education. I also take into account the values that you find very important in healthcare professionals and students, which is excellence, integrity, collaboration, and innovation. I can promise you this, that I entail these different values and find them just as important as you do in my nursing career. I also bring forth different aspects that I think would be very helpful and very useful as a student in your community. I demonstrate a clear understanding and good use of respect, as in respecting private and protecting the privacy of children and families in the hospital, being sensitive to the various beliefs and cultures that I would be exposed to at Sick Kids Hospital. I also demonstrate a clear understanding, and I try to treat people as a whole person, including their spiritual, intellectual, emotional, physical, and mental health. I also work to provide comfort and support to not only children, but the families that are involved in the healthcare process. Accountability is a huge one for our student nurses and nurses all around. Being accountable for my actions is extremely important to me, and I value it in an extreme amount. Being accountable for my actions is important, as this would demonstrate how much I respect my profession and how much I care about the work I complete. So demonstrating accountability would be creating that high quality care and creating child and family centered care. Also, flexibility is a big one. So I need to be able to accommodate for various children and their families' needs all at once. As a student nurse, I have become to learn that flexibility is very pertinent in the healthcare process and can make an extreme difference. Collaboration is another very important value and expectation, I think, as a student nurse. As a student nurse, I need to be able to not only collaborate with other nurses, like my preceptor, I also need to collaborate appropriately with physicians, occupational therapists, physiotherapists, social service workers, and any other healthcare provider that is involved in the child's care. I also need to collaborate with the children themselves, as they are responsible for their own healthcare as long as they are able to understand what's happening. I also need to collaborate appropriately with the family of the child in order to demonstrate a clear understanding and a clear amount of respect for these individuals going through something that is extremely incredible. I've had some incredible experiences as a student nurse, and I think my most memorable one was being able to work on the oncology floor at Lakeridge Health Oshawa. As you may have read in my application, my brother was diagnosed with colon cancer in September 2009 and passed away in April 2010. This was a very short road for us and our family, but it was a very educational role. And as a student nurse, I really understand the importance of family-centered care, as I was put in the situation on the opposite side of the nursing scale. So I was involved, I was the family, and the nurses had to revolve their care around not only my brother, but also us as well. It was a very, very traumatizing kind of experience, and I always try and tell myself and to my future employers is that who better to help individuals and families that are going through cancer than someone who's already been through it. I definitely have the clear compassion and empathy that these families and children would need in the situations that they are put in. I can guarantee that I will be nothing but respectful, accommodating, compassionate, competent, and knowledgeable when it comes to these situations. I also lost one of my best friends 2 years ago to Ewing sarcoma cancer. She fought the battle for 2 years, but unfortunately succumbed to her illness in February 2012. It was that was also a very hard loss, as you could imagine, and I'm sure you see a lot of this throughout the hospital, and this will be nothing new to you. But I came into this program because I wanted to be the nurses that were so good to my brother and to my family. I looked at them and I said, I wanted to be like them. I want to help people who have been put in the same situation as I have and make them come out as very strong and surrounded with support. And that's what I really hope to provide at Sick Kids Hospital. And as a student nurse, I truly value the education and knowledge as a very important value in my practice as a competent nurse. And I really demonstrate a true appreciation and respect for the education that I would receive at Sick Kids Hospital. Sick Kids Hospital is one of the best hospitals in Ontario, and it's known for its innovation and extensive client care and nurse-client interactions. I want to be one of those nurses. I know I can do it. I'm tenacious. I know what I want, and I go for what I want. I know I would be good at this, and I think that you would love the work I would bring to this hospital. And as a student, I would bring that enthusiasm, the character, the uniqueness, the funniness that these kids would need at a time that they are at. So I ask you to just please consider this, and I really, really hope to become a Sick Kids nursing student and get that education that is so prompt and is so very close to my heart. And I really just want to be a part of such an excellent team and be a part of this innovative nursing and healthcare professional atmosphere. I'm also, as on my application, as you probably already read, I'm also a baton coach to young girls from ages 3 to 10. And I will actually be speaking with one of them and trying to get her involved and learn what nursing is and learn maybe what cancer is and what it does to children. And I hope that this is just kind of tells you who I am as a person, as I like to interact with these kids. I like to really get involved with them and learn about them and help them learn. So thank you so much for listening, and I hope you enjoy when I get to talk to my friend Alexia Olson. Thank you very much. Hi, I'm here with my friend Alexia. Alexia, how old are you?
7.
And what grade are you in?
1.
1? Holy smokes. So Alexia here is my friend from Baton, and I also am a coach to her, and I have been for a little while now. I've known you since you were a little baby, right?
Yes.
So Alexia's in this video with me today because I'm going to do a little health teaching with the younger age group, seeing as that's where I want to be. Alexia, do you know what Sick Kids Hospital is?
Kind of.
Kind of? Do you know where it is? No, okay. Sick Kids Hospital is downtown Toronto, so it's in that big city that we have. And what it is, it's a hospital just for children like you. So whenever they're sick, they go there to get the help that they need from all the doctors and the nurses and everyone else. The floor that I'm looking to go on treats kids with cancer. Do you know what cancer is, Alexia?
Yeah.
Sorta? Sorta, kinda? Do you want me to give you a little lesson? Okay, so we have cells in our body, Alexia, and they're like little cells like this. They're very, very tiny. And and they make up our whole body. We have cells everywhere. They make up everything. They're really tiny, but they can make up the biggest things. So what cancer is sometimes these cells become a little abnormal, meaning they're not quite how they should be. And then sometimes these cells, they grow very fast and they spread really fast. So normally our cells, when they kind of get too old, they tend to die, right? And then we get new cells. These cells are not like the normal cells, and they just continue to divide and grow until they're out of control. And that's what causes something like cancer. And they form this big group and a clump, and they can stick on like an organ in your body. And then that's what causes cancer. Okay, and so there's lots of little kids that get it.
Like this?
Just like that, yep. And they can grow really, really big.
Like this?
Yeah, and they can start to damage your body's very healthy tissue. So they can start in one area, and then they also may spread to other different areas. And that's when kids get really, really sick. Yeah, just everywhere. And so the kids, they have to take a certain medication that helps kind of decrease those spreading and helps kind of kill off those really bad cells. And sometimes that treatment also may make them lose their hair, may make them very sick. But that's why we have nurses and doctors at Sick Kids Hospital, because they work to help those patients. Do you know what a nurse is, Alexia?
Yeah.
What is it? What's a nurse?
Somebody at the hospital who takes care of the patient.
That's perfect. That's pretty much what a nurse does. You nailed it. Good job. Yeah, so a nurse is it could be a girl or a boy, and they're at the hospital, and they help any patient that's sick with any kind of disease. Right, so,
Medicine.
yeah, and they give out the medicine, they make sure, everything's clean, and you're going to get better. That's why they're there.
You have to take one medicine each day.
That's right, and that's why the nurse is there.
Two.
Not two, maybe two. You might have to take 3.
Maybe.
But that's why the nurse is there. 3. But that's why the nurse is there, right? And they'll look after you and take care of you. So that's what I want to do. Do you think I'd be a good nurse?
Yes.
Yeah, you do? That's awesome. I'm glad you think I'd be a good nurse. Do you remember how I taught you how to use the stethoscope? Do you want to show everybody how you use it? Okay. Put those in your ear. And listen to my heart. Ready? Can you hear it?
Yeah.
Perfect. Do you want to listen to yours real quick? Okay. Put it back in.
Yeah.
Yeah.
Mine is going very slow.
Slow, eh? That's good.
Before mine is going super fast.
Fast, yeah. Good. So there, you learned something new today. You learned a little bit about kids' cancer. You learned a little bit about kids' cancer and how to use a stethoscope today. Is that pretty exciting? Okay, thanks so much for being in this video with me, Alexia.
Okay.
Thank you very much. Thanks so much for watching this video and taking the time out to get to know me a little bit better. I really, really hope and look forward to possibly seeing you next winter for my 4th year consolidation. I'm really looking forward to a challenge. I'm very tenacious, I'm determined, and I'm very dedicated to this profession. And I want to show you how good of a nurse I can be. So thank you so much, and I hope to hear back from you. Thank you.